Good morning. I'm presenting work done at the Cambridge Health Alliance, a community healthcare system in the Metro North region of Boston. This is an interdepartmental, interdisciplinary project involving the departments of psychiatry, family medicine, internal medicine, and pharmacy. We're using our EMR, our electronic medical record, to look at and improve upon physician monitoring for the health consequences of antipsychotic medications. Next slide. Patients with serious mental illness, such as schizophrenia and bipolar disorder, have a 12 to 15-year decrease in life expectancy because of many reasons, like difficulty getting to appointments or disorganizations. These patients get less medical care for their physical conditions, like heart disease or diabetes. And as a consequence, they're more likely to die from a heart attack or stroke. Medications used to treat serious mental illness, antipsychotics, have significant potential side effects, like weight gain, diabetes, high cholesterol, and which further has an impact on the patient's physical health. So the American Diabetes Association, the APA, the American Association of Clinical Endocrinologists, and the North American Association for the Study of Obesity held a conference on the subject of antipsychotics and diabetes. And in 2004, they published a consensus statement about the prevalence of obesity and diabetes in patients on antipsychotics, and they made recommendations about monitoring these patients. They said that doctors prescribing antipsychotics should be monitoring patients when starting the patient on a medication and at regular intervals after that. Doctors should be checking the patient's weight, blood pressure, blood tests for diabetes and cholesterol, and waist circumference. The idea is that if patients are checked for these things early and regularly, problems can be detected and changes can be implemented sooner so that medical complications down the road don't happen. In our study, we looked at how consistent are our doctors, both psychiatrists and the primary care doctors, at checking for these things at the recommended intervals. Next slide. So we started educational initiatives and developed EMR tools to increase awareness of the problem, to educate for the need for monitoring, and to facilitate the checking process. We developed and are continuing to develop tools within our EMR to increase the ability of physicians to check the parameters at the recommended intervals. So this is an example of a flow sheet. It automatically populates with the patient's weight, blood pressure, and lab results so that it's easy and quick to tell what the most recent values are for a patient and when it was last checked. We created something called a smart phrase, which is an abbreviation that can be typed into a patient's note. It automatically generates a statement that the doctor is checking for metabolic syndrome, and it includes the patient's most recent values. We are working on having monitoring for patients on antipsychotics become part of the patient's health maintenance field. And this automatically reminds doctors when something is due to be checked. We are doing grand rounds presentations, journal clubs, staff meetings, poster presentations to increase awareness for the need for monitoring and to teach our doctors about the EMR tools that we've developed to help make that process easier. So, next slide. So, this graph shows some of the data for psychiatrists and primary care doctors compiled who are starting patients on antipsychotic medications and how consistently they are checking the patient's weight, blood pressure, and labs when they first start the medication. We then compared the rates of checking before and after we implemented our educational initiatives and our EMR tools. Doctors at Cambridge Health Alliance were similar to doctors around the country, if not a little bit better, in terms of rates of checking recommended parameters. And as you can see, the numbers aren't fabulous. Our initial education efforts don't seem to have made much of a difference at all. Our physician awareness of the problem is not the only barrier, and education alone is not enough to increase the rates of checking. Many of our psychiatrists, for example, don't have a blood pressure cuff or scale in their office. Getting patients to get their blood drawn can be enormously difficult. Appointments are short, and it's hard to address many things at a single doctor's visit. Next slide. Ideally, the number of patients on antipsychotic medications who get checked for the metabolic parameters at the recommended intervals would be 100%. And for a number of reasons, we're not there. We're continuing our educational efforts, and we're working on more EMR tools to remind physicians when a patient's due to be checked. But in addition, we're discussing systems-based changes that we can implement to increase the rates of adherence to the monitoring recommendations. We hope this will ultimately result in better patient health.